Good evening, everyone, and thank you for joining for this media briefing. We will be addressed this evening by Prime Minister, the Honourable Mia Amor-Motley, and the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostick. Minister Bostick will begin.
Thank you very much, Lisa. Good evening to everyone. I want to start today by indicating that for the test results for the 10th of October, which we would have released today, 1,706 persons would have been tested, and the results produced by the Best Dos Santos Public Health Laboratory. Out of those 1,706, there have been 214 new positives. 214 new positives. And I would also indicate to you that 55 of those positives are persons under the age of 18. First of all, let me caution you about the 214 because I know that figure is much lower than what you have been seeing recently, and I don't want people to become complacent, because obviously once we've had 200 and 300s for the last several days, within a few days these figures are likely to go up. So I just want to caution you and to alert you about that. But one of the striking things for me is the fact that 55 persons under the age of 18 have tested positive. I've spoken to this worrying trend before. And I think for me and for the team at the Ministry of Health and Wellness, this has been one of the game-changing events or occurrences in this current surge caused by Delta. So that between the 1st of September and the 10th of October, we would have had a total of 872 positive cases of persons 18 years and under. I also would report to you that currently in our isolation facilities, as at 7 o'clock this morning, we've had about 113 persons under 18 in isolation. And this is a game changer, as I said, because this is not something that we were seeing previous to this surge. And what I would like to continue to urge all parents and guardians and wards, family, that we have a duty and a responsibility to try to protect our children, especially at this time. And I would like to urge all persons to ensure that those who are old enough to take the vaccine, that they do so, because it is in their interest, is in the interest of the educational system in terms of face-to-face classes resuming in this country, and it is also in the national interests. Another game changer really has been the fact that we are seeing more people being sick as a result of this Delta surge, and this is evident in the isolation facilities when we assess the persons who have tested positive, and also at the Queen Elizabeth Hospital Accident and Emergency Department and the extension that they have established there to be able to deal with persons with respiratory problems. We are seeing the same thing, and so we're seeing more and more sick persons. And this is also reflected in the composition of persons within the isolation facilities, so that where the average occupancy level at the isolation facilities across the board would be about 56% at this point in time, we are seeing about 74% in primary and secondary isolation at Harrison Point. And so in anticipation of what this could lead to going down the road, we've taken the decision, and the work is in progress, to refit the tertiary installation facility at Harrison Point so that that facility can become more of a secondary facility with the installation of oxygen and so on. And this is in keeping with what we are seeing on the ground, and we are fighting an enemy that is evolving, that is changing, that is doing things differently, and so we have to readjust our strategies and our tactics to be able to remain in this fight. And that is something that we have been doing. We've also seen, obviously, an increase in the number of persons who are in home isolation. I would have spoken to you a couple of weeks ago, and we would have indicated, both the Honorable Prime Minister and myself, a week ago, sorry, that with the rollout of the program of home installation, that it will take a couple of weeks for us to really get it to the point where we want to get it. But we had to start it because perfection is not something that we could have allowed to get into the way of what really was a real situation, the fact that we were having greater number of positive cases. And so at this time, we've been experiencing some delays in terms of getting persons out of home isolation who we want to get to facilities for assessment. But we have improved significantly over the last couple of days, even though we still have a ways to go. We've had teams on the ground doing assessments and also doing telephone assessments, private sector led, as I would have said before, and with the assistance of the medical officers of health at the polyclinics, who have been doing a similar thing when they have been contacting persons to inform them that they were positive and to do what level of contact tracing that they could do at this time. So that is in progress, and we expect that that will allow us within the next few days, 2-3 days, to be able to get to a point where we are within 48 hours that we will be able to do everything that is required. We've enhanced resources by adding additional people to these teams, as well as trying to deal with some transportation issues to be able to respond at the same time to those persons who might call in for help to say that they were not feeling well, or that they had people who needed to be taken from home. And so we have started the process of retrofitting some vehicles to be able to take sick persons. And we have also established partnerships with some of the private ambulance or acute care centers that have ambulances, along with obviously the emergency ambulance department of the Queen Elizabeth Hospital. So all of these things put together would give us greater capacity to move a bit faster with the home isolation process, and we expect that within a few days that we will be able to get this to the point where it is much more manageable, and so that persons who are at home that we want to get out, we will get out in good time. But I'm happy to say that a few hundred persons have been transported from home based on the assessment and the triaging process, and we've been able to move a few persons that we classify as red, or persons who are ill and needed urgent attention. That has been going quite well. So those are the things that I wanted to share with you today, and also to report that the elderly care facility that we've spoken about before, as well as the outbreak at the geriatric hospital, that at this point in time, those two situations are being managed quite well. We are not worried at all about what is happening at the two facilities. There are no isolation facilities, and at the geriatric hospital, a part of that hospital is an isolation facility, while we continue with the healthcare services to the other clients who occupy the facility. So that is it for me at this point in time, and over to you, Lisa.
Thank you very much, Minister Bostic, and the Prime Minister will address us at this time.
Thank you very much, Lisa. Thank you very much, Minister Bostic. Good evening, Barbadians. It is a pleasure to be here to talk with you again. When last we spoke, it was a week ago Sunday, and the bottom line is that, as I've said to you throughout this entire thing, we are going to speak and share as much as possible. But today, I want to start by expressing sympathy again, as I did last week, for those who regrettably have passed from us. This is a difficult time for the nation, as we said. Many of us are not accustomed to these kinds of events, and therefore the passing of Barbadians by something that has literally come upon us over the course of the last 20 months is something that we will never get accustomed to. Our health system and our professionals, health professionals, from orderlies and persons working in the support services right back up to the nurses and doctors, have been under strain. And indeed, we've said that over and over. Weaker nations probably would have literally succumbed already. but we have taken our time to plan and to be here and to recognize that the battle that we are facing is not an easy one. Minister Bostic has been absolutely brilliant in reminding us of that over the course of the last 20 months. And it is that commitment from the professionals in the healthcare system on the front line, with those in the ministry, with those across the country, that we've been able to reach as far as we have reached. And I really, really want us to thank them, and I never will tire of doing so. But we also have to stop and take guard as a nation and as a people, because even though they're doing an excellent job, and even though the government has literally done what it needs to do to put things in place, we have to also see where the gaps are and where we need also to put in focus the need for greater personal responsibility. We also, therefore, have to look and see what has to be done. I've said over and over that the government's role has been to provide the enabling environment and to meet the requests of the healthcare system, whether those requests relate to the outlay of cash, or with persons, or with institutions, or with construction, or with equipment. And believe you me, that is why I was so dismayed yesterday when it was suggested that we had a shortage of ventilators, when in truth and in fact, Minister Bostic, I think, will confirm, we actually have a surplus of ventilators. We may have some other challenges in the system relating to HR, and that is why last Sunday night I would have indicated to you that I was leaving the address to the nation to meet with the doctors in the country. We met with just under 400 doctors, and I want to thank the Barbados Association of Medical Practitioners and Dr. Williams and her executive for arranging that meeting. And we met for almost 4 hours that evening, dealing with all kinds of problems, both current and those long past, long before I even came into public life. But the bottom line is that what we were able to do is to recognize that we really need to be able to pull as one. This is not a case of public sector doctors or public sector nurses or governments alone trying to face. This is a national effort. This is an effort that requires all of us. And in the same way that we came before, and we've said to you step by step by step, this thing that came onto us 20 months ago, nobody knew what it was, the level of fear and anxiety and angst, we accept all of that. But month by month by month, we've been able to put together systems, deal with facilities as we have at Harrison's Point and elsewhere in the country, deal with having expanded medical capacity through the nurses and doctors from Cuba and the nurses from Ghana, dealing now with the local doctors, drawing on the private sector doctors. And as I go on this evening, you'll see exactly what we mean. We've already indicated that we have Dr. Brian Charles leading the team of home isolation and Dr. Dana Grandison leading the team of home quarantine. And Minister Bostic has already indicated that we've had, as we've been rolling it out, it has taken a little longer to roll out than we would have liked, but we're satisfied that we can kill the backlog within the next few days, and that we will then be in a position where within a 36 to 48 hour period we can deal with everybody who has to be dealt with. I'm also had the Chief Medical Officer, Acting Chief Medical Officer Dr. Anton Best confirm to Minister Bostic and myself that the persons who are calling from the polyclinics are also doing an initial triage to be able to see those who are really ill, but that is then followed up with a more thorough triage, tele-triage, that is going to be led, as I said, by Dr. Grandison. My friends, the reality is that we have limited capacity in a small state, always do. But we are confident that where we work together and where we treat to this as a national issue, that we will always succeed. And that is exactly where we are today. Our numbers, yes, are rising, but if you cast your mind back a few weeks or a few months ago, we also indicated that we expect this to happen with Delta, and the truth is that Delta hurts us where we're most vulnerable, in our homes, and it only requires one person to bring it in, especially where the rest of persons are unvaccinated, and for it then to do its damage among the households. We have no doubt that it doesn't get there by itself, and therefore that is why we've said to you outside of your households, please continue to observe the protocols and please continue to get vaccinated. And it is to this that I want to speak a little bit now, because when you look at the numbers, and as of 5 o'clock this afternoon, I think it was 142,543 people that had been vaccinated. My friends, that is more than almost 60% of our eligible population. And why do I say eligible population? Because you and I both know that persons who are babies right up to 12 years old cannot take a vaccination. And therefore, we have to recognize that the class of persons to whom a vaccination can be given are those 12 and over. 142,543 have taken it. My friends, that is almost 60% of the eligible Barbadians who have taken it. And I've asked Minister Bostic's people, I see that they've put onto the dashboard the percentage of fully vaccinated of the eligible population. I ask them now in front of you to put one other line. Don't take off any, but put the line of the percentage of eligible people, the percentage who have taken the first vaccination of the eligible population. And why? Because once you have taken that first shot, you've already made up your mind to go along that route. And Major Clark and Dr. Ferdinand have advised me that virtually 99% of the persons who have come for a first jab come back for their second jab. That tells you that Barbadians are serious about this thing, and they're making sure that they comply wherever possible. It is in that regard that I'm happy to report that if we can continue at this level, believe you me, we will make it. But we equally have to recognize that we took a decision that we weren't going to mandate. And why? Because mandating means that I have to tell you, or we have to tell you, that somebody needs to put something in your body. We accept that. That is difficult, especially for adults. And we've said that we're not going there with adults. But by the same token, I also have to remind you that we have a duty also to those people who do not want that thing which is in your body, which may be a virus, coming out to contaminate or infect them too. And therefore, there has to be a balance with respect to the duty of care that we have to all Barbadians. Let us be very clear that the lockdown, we know, does not and did not and will not work well. And in fact, there's a lot of mental fatigue, not just in Barbados, but across the world. The Prime Minister of Norway, Erna Solberg, has indicated that. There are a number of other countries that have also indicated that the mental fatigue after 19-20 months is making it difficult. We believe that in spite of that, that we have a duty to create a safe place and a safe zone. And that is why we feel that at this stage, we now have to take fresh guard and to look at what is possible. From the very beginning, I've told you that we are not going to literally abdicate our responsibility of governing. We have and listened and consulted widely. We've indicated that we feel that we need to work hard to encourage, and believe you me, I have never worked hard at anything than in my life than asking people to protect themselves with this vaccination. But that does not mean that we mandate. And we recognize that that is difficult in the context of the island this size. But it does mean that there are consequences to the choices that you make. And we have said over and over that principles only mean something if it is inconvenient to stand by them. And that is why we've been consulting, not just here, but across the globe. I've been speaking not just to political people, but to technical people. I've indicated we have advisors, thanks to PAHO and thanks to WHO, but we've also been speaking to other technical people within the region and further afield. And the reality is that we are satisfied that we need now at this stage to start the process of the creation of safe zones. And what do we mean by safe zones? That we need to be able to have places where persons are either vaccinated or recently tested. Vaccinated or recently tested. Because at the end of the day, what matters is that you are safe and not in a position to put each other at risk. 142,000 Barbadians, 543 Barbadians have spoken with their feet. and they've spoken with their arms. And they've said, look, we believe that our personal responsibility is to take care of ourselves. And in so doing, what we're asking the rest of us to do is to recognize that if you are not prepared to take that test, then you would have to be prepared to be tested to assure the rest of us that as we mix, whether it is at work, whether it is in places of entertainment, whether it is in places of worship, whether it is in restaurants or hotels, that anywhere where people will frequently be, that there must be a safe zone. It is the realistic option that we choose. It is one that is born of us having had now almost 60% of eligible Barbadians in that position. As I said, when we get to the higher numbers of 70% of persons who are eligible, then we will start to look at adjustments to the further hours of restriction of movement. And why have we said this? Look, there are those who will say, shut down again, lockdown again. But my friends, you and I know that lockdown don't work, and lockdown is not going to work in this, especially after 20 months of mental fatigue. But I know that it is within our capacity as Barbadians to do the right thing. And how do I know that? Because you've already done it. This country has a higher percentage of persons who have chosen to be vaccinated as an independent nation than most. And largely because it isn't only about what we have been able to secure as a government, but it is also about what you have responded to and gone and taken with your feet and your arms. You have walked there in many instances. Or the shut-ins that we had before, we came to you. We have come to you and asked you, look, please protect yourself. This is fundamentally a matter of personal responsibility. The doctors have all been very clear that if you are vaccinated, you have less of a chance of catching it, you have less of a chance of being contaminated, you have less a chance of literally dying from it. Doesn't mean that it doesn't happen, but your chances are so minuscule that you are fundamentally in a better position. And let me contextualize it, because if we get that, it explains why the majority of people who have been literally becoming sick are persons who are unvaccinated. And that is why we say, look, you don't even hear us talking about herd immunity so much, because what we want is for each Barbadian, as far as possible, to take personal responsibility and to protect themselves. We have said that we have our own way. And believe you me, when we came to you in 2018 and told you that we are going to create the Barbados Economic Recovery Transformation Program, that it will be a homegrown program, that we've taken the best of what we've seen regionally and internationally, but we've also deconstructed our problems and determined what is necessary for them. In this particular instance, 20 months into this pandemic, recognizing that we now have 60% virtually of eligible Barbadians, just shy, 59.1% I think it is. Recognizing that high number of persons who have already taken at least one jab, then I believe that we have a responsibility now to move to the next level, which is the creation of safe zones. And why? Because you, the majority, have spoken. And as our government, we therefore are now going to take the actions. The Ministry of Health will therefore lead us in a series of bite-sized chunks. And why? Because we have limited capacity as a small state. I would love to tell you that we can do the guidance notes for every area and every sector, bam, one time. But if we want to do what we're doing well, while at the same time managing the home isolation and the home quarantine program, then we are going to do it in ways that are manageable and sustainable. So my friends, what is the area of greatest concern to the government? People who can least protect themselves. Our elderly persons in institutions, be they nursing homes, the geriatric hospital, the hospitals, or those, for example, who are living at home but depending on caregivers, or people who are generally sick in hospitals and clinics. These are the most vulnerable in our society at this point in time. And we have, as a nation, a duty to protect them. In many instances, these are people who have given blood, sweat, and tears to this country. and therefore we cannot stand idly by and see them at risk, particularly when we now know that we have sufficient larger numbers to be able to help us protect them. Those guidance notes, which the Ministry of Health will issue very shortly, will make one fundamental point for us straight off: that they will be testing persons based on risk. And what do they consider as high-risk areas? Intensive care units, be it the medical intensive care unit, the surgical intensive care unit, accident and emergency, urgent care facilities, the 24-hour urgent care that we have in the polyclinic, the isolation facilities where the doctors and nurses and other staff, they are at risk because the person in isolation is already positive. Swabbing centers, nursing homes, and outpatient clinics. The Ministry of Health has indicated that those are the high-risk areas, and therefore when you see the guidance note come out later this week, it is anticipated that unvaccinated persons, for example, in these high-risk areas will have to be tested at least once a week in order to ensure that we are taking care of those who we have to take care of. The truth is that persons who are vaccinated will have a less frequent regime, but study and go through the logic. The reality is that persons who are vaccinated are less likely to catch it, and if they catch it, they're less likely to be contagious because it's not going to stay with them long, and if they also catch it, they're less likely to be serious, in which case their period of time ill is going to be much shorter as a healthcare worker than if they were unvaccinated. Without prejudice to all of this, we will continue, and I've asked the hospital, I've asked the different facilities in the Ministry of Health, don't just meet now in groups. Let us deal and meet with people's concerns one-on-one so that we begin to understand why they would want to put themselves at risk, because they're effectively putting themselves at risk in circumstances where persons coming at them too may well be exposed to the virus. We do not want to see anyone affected unnecessarily. And therefore, we're asking you, if you can work with us, let us ensure, one, that these safe zones, yes, if you're unvaccinated, you will have more frequent testing, but at the same time, we're saying, and we will pay for the tests, I'm not asking anybody to pay for the tests, but we are saying that we need, at the same time, for you to apply your hearts and to think on these things. We know that a lot of people are nervous still and have angst, but the majority of people in this country have taken the vaccine. And when we look across the world, it is literally billions of people across the world who have taken it. And we have not seen the level of fallout that we expected, that others promised that we would see when people take vaccines. When we finish, these workers in healthcare institutions, and by workers we mean all workers in healthcare institutions, but we accept that certain departments are not as exposed or not as high risk as others, and therefore there will be different times for them. We are including nursing homes, and we are including, as I said, all hospitals and clinics. With respect to persons who work with caregivers, we suggest to you that you ask them also to regularly test, especially where that caregiver is taking care of an elderly person home at you. And this needs to be the standard. If you're not going to mandate vaccines, you have to mandate a safe environment. And that is what this government is doing. And the safe environment we're mandating requires vaccinations or recent tests and regular tests based on the level that have been recommended to us. And I believe PAHO sent in a virologist who has also worked with the Ministry of Health to help guide us on this. After they finish the healthcare workers, I expect that we will see a guidance note soon thereafter for frontline workers and also for tourism and hospitality workers, and thereafter for those working within the educational sector. I will go down the line. I haven't called out all, so don't believe that this is an exhaustive list. But what I am asking you to recognize is that the Ministry of Health will work through step by step by step. Where I will take a more active role, I will also ensure that we meet with the business community and the labor movement again over the next few weeks to see how we create safe zones for patrons now. Because one thing to be for workers, it's another thing for those who are patrons to restaurants. Mr. Chapman asked me to consider, and we are, how we are going to deal in the medium term with persons with respect to either entertainment places or places of worship, recognizing that the density numbers can change certainly in places of worship if it is a safe zone. I look forward to working with the Christian Council and the Evangelical Association on that. I look forward to also working with those in the entertainment sector to see how we can create safe zones for persons who want to be part of the entertainment sector. And it may seem counterintuitive to some, but the reality is that this virus will be brought down if we deal with it one by one by one by one, basically ensuring that we take personal responsibility, that we vaccinate where possible, and where we're not choosing to vaccinate, that we at least regularly test so that that person who is unvaccinated does not unwittingly become a risk to the majority of persons in the country who have chosen to vaccinate. And as I said, I'm always going to protect people's rights and freedoms, but at the same time I profess also that where there's a responsibility, you have to stand up to the responsibility. And the reality is the responsibility for you not to infect somebody else is as strong as our responsibility not to put something in your body. And once we understand that, then we can move this country forward, particularly given the fact that this has been a very, very difficult time over the last 20 months, not just for Bajans, but for the whole world. So we appreciate the keenness of the business community. We appreciate the keenness of the workers' movement. We appreciate the keenness of others who recognize, well, why you're not moving to create the safe zones? We get there and we do it, but we have to make sure that when we do things, that we are doing them in a sustainable way. And I understand the concerns and the doubts of people initially. I even understood them with the vaccinations when we started in February earlier this year. But we have learned and we have made the determination that we need to make in order to be able to protect as many people. And you Barbadians have stepped up to the plate and have said, look, we are prepared to do this thing. Now we feel, and I set a target of an ambitious target of 10,000 per week. And while we didn't make the 10,000 per week, believe you me, in the last month we have done more than 20,000. I asked them for the figures before I came, but I didn't get it. But the bottom line is that I know that we've done more than 20,000 in the last, and I'm talking about first vaccines. If I add in the second ones, we're probably up in 35,000 or whatever in terms of what we've done in the last 4 to 5 weeks. So that the country may not have moved at the same pace that I asked for, but everyone who knows me will tell you that I also ask for us always to shoot at a faster and higher rate than persons would normally do, because as they keep saying, if we shoot for the stars and we end up with the clouds, we're way above the earth. And that is what we have to always remember. And I am confident that we will continue. And why am I saying that? Look, as I said, there are no major vaccinated incidents that we know about in this country, and the ones that have been heard about globally are minuscule in comparison to the number of persons who have been vaccinated across the world. But we accept that in order to reach, there are a lot of persons who are not yet there, that there's a lot of angst and nervousness still with some people not wanting to come out of their houses. I've asked, therefore, that the mobile vaccination team be resuscitated and that Dr. Hilary Moore lead the team for us with private doctors predominantly. Many of them were working along with Major Clark and Dr. Ferdinand in the community pop-up clinics and the polyclinics. But separate from that, we feel that the time has returned for us to do as we did with Operation Seek and Save and go into the houses where persons are over 70 and not capable of moving or not comfortable to move. And secondly, to also deal with those who have chronic NCDs but are patients of the Queen Elizabeth Hospital as outpatients or patients of the polyclinic system. And we are going to also put in place, separate from the mobile team that will call you, people will be calling you, and where you have not heard anybody, there will be a special line for you to call as well. If you're uncomfortable and you don't want to leave home, we will come to you and make sure that you get it. By the same token, we have also agreed to put special lines in place at the 3 clinics And those 3 clinics are Alexandra School in the north, Princess Margaret School in St. Philip, and the Eunice Gibson Polyclinic in Warrens. Those 3 clinics will have special signs for persons who are over 70 who can be expedited and brought without having to wait in the normal line. And similarly, a special line for those persons who have chronic NCDs, heart problems, serious diabetic. You're attending the QEH as an outpatient, or you're attending the polyclinic as a serious outpatient. There'll be a separate line for you too at those 3 clinics. And we're doing this because we're satisfied that we can boost the numbers and that we can get to that 70% of the eligible population and even beyond that, because that's the floor, that's the minimum we want to reach before we start to remove the restrictions. But in the ideal world, we want to get at least to 75% of the eligible population. And why do I say so? Because I know that once there is a vaccine created for these babies to 12s, that we're going to get an appreciable uptake also from a number of persons, which will then create a separate stream of persons on top of that 75%, so as we look for the overall population. If you look at this, I've said over and over, my friends, that this is a marathon. This is not a sprint. And what do I mean by that? That we have to learn to live with it. That's why you hear me continue to big up the healthcare professionals. That's why you hear me continue to say thank you for us being able to have a national approach and not just a governmental or public sector approach. And I've said that to Dr. Williams, Dr. Grandison, before Dr. Williams, to Dr. De Silva. We can go on and on. I want to thank those doctors who came out yesterday, writing also, senior doctors in this country who have come out encouraging persons to vaccinate, because they, like all of us who have been vaccinated, know that there's nothing wrong with us other than a little pain the first day for some, and in some instances some people might get a flu like symptoms, but for the most part there's nothing really. So that we are asking the rest of us to each one reach one, and if we do that, then we can get back to as normal as possible as soon as possible. We want also for you to have a good Christmas. We want also for you, it doesn't mean that you're going to have the kind of Christmas where you can just be carefree and forget about protocols, but we believe that even with the use of the protocols, the sanitizing and the mask and the vaccination, that we can get to a point, particularly with the creation of the safe zones, safe workplaces, safe zones, that people can get back as much of their life as possible. But what is likely to happen? And I say to my cabinet all the time, as well as to the officials in the Ministry of Health, let us not be surprised by what we expect. Let us never be surprised by what we expect. We expect that the numbers will be a little high for a while. That is true. Regrettably, we are trying as hard as possible to minimize the number of persons who will succumb. But what does that mean? It means that you have to help us help you. It means that you have to take personal responsibility, and when you're feeling ill, pick up the phone and call us. I've asked for a dedicated number to be put in place so that even with the home isolation and the home quarantine program, even with the home quarantine medical tele-triage as they call it, that you can pick up the phone and say, look, I ain't got a taste in my mouth, I really am feeling well, or I got a sore throat. I need you to ask somebody to come and pick me up, because we do have space in the isolation facilities even now to be able to take care of persons who have to come in. But my friends, it requires you helping us to help you. And that's why I say the government has done and will continue to do what it can. The doctors are doing, and the nurses and the health professionals are doing what they can and must. But we need each Barbadian now. Not just the ones listening to my voice now, but all who didn't hear me tonight, you need to tell. And all who didn't hear me tomorrow, you need to tell. Because what we need is people saying, look, if you're in feeling well, call the people. When you call the people, the quicker the people get here and be able to take care of you, the quicker we can make sure that you get out, hopefully, safely as possible. But it is those people who come into the system late, If Dr. Ford was here and the other doctors are here, they would repeat themselves. Those are the ones who give and have the least chance of being able to survive, either in terms of long-term sequences or alternatively, even regrettably, with their lives. So, as I've said earlier, I want to thank the others with the home quarantine and the home isolation program. We've agreed that we're going to bring the backlog down, Minister, and I want to thank those doctors and other healthcare professionals that are volunteering and working as we speak. The numbers that we had on the weekend were much less than the numbers that we have now. I think we have at least 24 persons working now at 5 o'clock this evening, and that does not include a number of others who are due to come on in the next day or so. And I expect that we will have close to near 40 people by the time we finish in terms of backlog, and then we go back into the normal situation. But listen to me carefully. Regardless of that, if you are not feeling well, pick up the phone. Do we have the number yet? What's the number, please? Just give me the number. 536-1800. The number is 536-1800. And I will ask the others to get that out in PSAs so that every Barbadian, people like to share WhatsApp when they want to laugh, but share WhatsApp to save people's lives for me, please. I beg you do. You understand? If you want to share WhatsApps to laugh and to make sport, share one for me now to save people's lives. Because if people can call early, Dr. Ford, Dr. Hassel, Dr. Lovell, their whole dedicated team, they are in a better position to help you if you let us know early. And that is why we're working so hard to get the triaging right with the home quarantine program. And my friends, last Sunday night, we told you that. We told you this is a new thing, and it is going to take time to get the teething problems out. We're getting there, and I'm satisfied that before the end of this week, we should be there, back and on a path that will allow us to do it step by step and to take care of each of you as best we can. I also want for us to recognize that this is the moment, my friends, for Bajans to prove that we can stand up and do better. And the leadership of Barbados must be united in this resolve. This is not a government battle. This is not a battle for the Ministry of Health. This is not even a battle for those who have caught COVID alone, because when you look at the numbers, as I keep saying, it's less than 11,000 Barbadians that have had COVID in the last 20 months. But this is a battle that requires all of us. And that is why you see me reach out on every occasion, across aisle, across sectors, across everyone. That is why you see, this is not a case of Barbados trying to head the pack. This is a case of Barbados trying to carry everyone along as far as possible in the pack. And why? This country is a small country. There is nowhere to run. And the one thing that we've learned about the DNA of this country is that, one, apart from it being worth fighting for, that as far as possible Barbadians must literally help take the country step by step by step by step. I'm asking you, each of us, if we're not on board yet, join the effort. And I don't mean the vaccinations alone, I mean the entire effort of rebuilding this country from COVID. And why? Because, as I said, without it, we will not be able to move forward in a way that is sustainable. This is not a case of headlines for me now. This is a case of us trying to literally keep this country together and to make sure that we move as many people step by step by step by step. As I've said from the beginning, this government, we protect your right not to have anything put in your body as a mandatory vaccine. But equally, we're also asserting now that 142,000 Barbadians have already shown that they are not prepared to have others also infect them because they're unvaccinated. And we have to strike the balance. And we believe that that balance comes in safe zones and safe places. We accept that it is going to take time to roll out over the next few weeks, but I felt that it was important for you all to understand where the government is going and where the government is trying to take the country with respect to this. The first guidelines the Minister will have done before the end of the week, and that will be shared with all of the healthcare institutions, as I said, as well as the nursing homes, so that it applies to all private and public. Yes, vaccinated workers will still have to test, but it won't be as regular, obviously, because they're not as high a risk as the unvaccinated. But those things will be worked out and will be revealed. But the ones that we have to do is to continue to talk with each other, because it is in our interests to make sure that 80 to 85% of persons who are getting COVID and who are not vaccinated, that we protect you as far as possible from getting ill. My friends, this is our time to show that this country is special. This is our time to show, as we have already done, and that's why I say I'm so proud of you, that the mere fact that we can have almost 60% of the eligible population, 6 out of every 10 persons effectively in this country, have already said we accept the responsibility to protect ourselves. We know that there are a few who will never be able to do so. Some of our older people, some of our younger people, and some of the people who are immune compromised in one way or another, or who the doctors have said can't take it, and some who for philosophical or religious reasons are not taking it. I am asking us, please, let us close the gap. I use that phrase when we talked about closing the gap for the climate, because we are going to be the victim of that climate crisis that is engulfing the world. But in this pandemic, it is possible for us to continue to close the gap. And whether it is the mobile teams going to the shut-ins, whether it is persons coming to the dedicated lines in polyclinics, or whether it is ordinary persons coming because they know that they have an auntie or a granny or an uncle or a daddy or a mummy at home that they want to take care of, and they don't want them to catch nothing from them, or if they catch something from them, they don't want them to die, and they're therefore making sure that they themselves are vaccinated, making them less likely to spread it, less likely to catch it. That is what we want at this stage. And if we do that and we work out and be patient, working out these safe zones over the course of the next few weeks, so that this country goes into a position where people can have as normal a life as possible. I don't think we'll go back to old normalcy for a little bit globally, but we can at least do better, make sure that more people are working again, make sure that more people are in a position to take care of their families again, make sure that less people get sick again. And there's going to come a time, I know that it may sound controversial, Jeffrey, but there's going to come a time when mentally you're going to have to stop looking at numbers of cases daily and start to look at only the hospitalizations and the deaths, because the number of cases daily don't point to anything other than the fact that a small subset of them will get very sick. Those are where our efforts must be focused on. Those are the people we must move heaven and earth to protect, and those are the persons that, if we recognize, and I say this conscious, that COVID is still not the largest responsible for the largest number of deaths in the country, but it is because you don't know who it will hit is what makes it deadly. And that is what the COVID roulette is, what makes this particular disease difficult. So my friends, I'll stop at this stage, but believe you me, I ask all Barbadians to recognize that this country is worth fighting for. And if we are going to bring it back to the level of stability that we know it needs in order for people to prosper, in order for us to overcome our vulnerabilities, in order for us to close the inequalities, then I'm saying to you that the majority of us must continue walking in the same direction as we have already started to do. We've done it quietly, we've been going around the country in every nook and cranny, but we're now saying to you, please continue each one to help us reach one. Thank you and God bless. I'm available, I believe, Jeffrey, we're available for some questions now. Lisa?
Yes, thank you very much,
you.
Prime Minister. And as we open for questions, joining us from the media are Emmanuel Joseph from Barbados Today, Trevor Thorpe from CBC, Ian Bourne, the Bajan reporter, and Barry Allen from Nation News. Gentlemen, your questions?
Good evening, Madam Prime Minister. The Barbados Hotel and Tourism Association has said they wanted all of their employees to be vaccinated by December 1st, and they wanted your government to institute a mandated vaccine. But you have said no mandated vaccine, you have just said safe zones. My question is, do you foresee the safe zone getting around to the Hotel Association by December 1st for the start of the new season?
Absolutely, and that's why I said that we're starting this week with the healthcare workers, largely because the people who are most vulnerable are literally those persons who are elderly and those persons who are sick. And that is our first priority, but I expect in the next week or two that we will have completed for frontline workers, that we would have completed for villa and hotel and tourism workers and tourism attractions, that we would have completed for ultimately education. Education is the one probably at the back end of that list, largely because we are still doing the online schools with the education at this point in time.
Yeah, that's my focus. Good evening, Ian Bourne, Beijing reporter. Based on the fact that the Prime Minister pointed out that babies to 12-year-olds can be vaccinated yet, how, in going forward, would the Ministry of Health and Wellness be advising the Chief Education Officer, who was foreseeing a possibility of face-to-face education by the end of this year?
We're hopeful. I mean, I've already said to you, Ian, that 6 out of every 10 eligible Barbadians, that includes people 12 and older. So that includes your secondary school students. As it relates to persons between babies and 12, we're waiting for the approval of the vaccine for those. So they remain outside of the scope for now. But let us recognize that it is within our capacity easily to do 1,500 people a day if we really wanted to. And that's why I keep saying that between those who are shut in and those who may not, there are a lot of people who are genuinely frightened to come out the houses. We get that. And therefore we're going to send people to you. There are others who cannot come because they can't move for whatever reason. We get that. We're going to send people for you. And then there are those who perhaps just need a little nudging, and to know that for those who are not vaccinated, you're in a minority now. You're not in the majority. So that the reality is that mandating against a majority vaccinated population has a completely different ring than mandating in a population where the majority is not vaccinated. So we hope that we will continue with the moral suasion, and we say this largely because we have no choice but to keep this country stable. There are people who from other islands may not get it. There are people who may not understand what it takes to keep Barbados together. And there are people who may not understand these things because it's not part of their experience. But this country has always remained stable because the majority of Barbadians have done the right thing. And I have confidence in our people, and they have already proven us right by having 142,543 people take a first jab up to 5 o'clock this evening.
Madam Prime Minister, you also had mentioned in the past that there's no intention to mandate vaccination. However, there is a hire purchase conglomerate that is providing an incentive for people to want to get vaccinated. Is that a possibility for a broader scope in moving forward to encourage vaccination?
Members of the private sector are free to do what they want to do with respect to encouraging persons.
Yes, but would government be looking at a similar incentive?
No, we're not, because government has already, look, we've kept this country together. We've put everything that the Ministry of Health has asked for. We've built the institutions. We've hired the additional people. We've got the vaccines. We've done everything that we've had to do while losing $600 million in revenue last year. We will continue to do it. My own view is that the greatest incentive for any person is the saving of their lives and the protecting of those around them. And Pope Francis says it is an act of love. Having said that, we're not going to stop the private sector who want to incentivize. This is the same country that complains about transactional politics on election day. You understand? This is the same country that complains about people raising the ante on them election day. Look, this is serious business now, and we need to get people to accept that, what did I say? Personal responsibility. By the way, one of the things I should have said to you is that we're also getting, and I want to thank President Ali from Guyana again, who once again has shown that he's prepared to be a friend of Barbados all the time. Guyana is prepared to be a friend, and we will receive 7,000 Johnson & Johnson vaccines tomorrow at 10 o'clock from Guyana. which, as you know, the Johnson & Johnson vaccines are single-dose vaccines. So we believe that this will work well, particularly for some of the shut-ins, so that they can, with the one jab, be protected. And we're continuing. Tomorrow, as you know, I have to travel to Washington, D.C., to World Bank and IMF meetings, but also to have meetings with the different elements of the United States government, and we'll be following up again on this other issue of vaccines. I've already told you that we've also paid for 14,000 Pfizer vaccines from COVAX that have not yet come. That was in the report that the Director of Finance put in the Parliament of this country.
Next question.
Good afternoon, Prime Minister. Barry Allen here from the Nation newspaper. Can you at this stage elaborate a little bit on the logistics of how safe zones can work within a Barbadian workplace? In other words, when these safe zones are created, will we see segregation or separation of vaccinated and unvaccinated staff within a single workplace? How will that?
Deconstruct it, Barry. Deconstruct it. If you arrive with the vaccination and you're tested regularly, it means that both of you have attested that you're safe. And that's why you see all the time I keep saying deconstruct and reconstruct. And what is the public purpose we're trying to have here? The public purpose is that we want a sign that a person is likely to be safe. Vaccinated persons tend to be safe generally, but we can't always say that definitively, which is why they'll still be subject to some random testing or longer duration testing. Persons who are not vaccinated are much more likely to be contagious, and that is why in high-risk areas we say let us do it once a week, recognizing that a person will show symptoms with Delta within 4 to 5 days, I believe, and with Alpha 5 days or so. So the doctors have recommended that period of time for high-risk persons. It doesn't mean that they have to show it before they go into the workplace. The workplace will work out the scheduling with them depending on what is convenient for the workplace. So it might be 2 o'clock in the afternoon. It might be 4 o'clock before you go home. Don't know. It's going to vary from place to place to place. And that's why I said, look, I have confidence in my country. I really do, for us to get it the right way and to do the things. And for those who believe that we're not taking decisions, let me say to you directly, we are taking decisions, but we're taking decisions that hold this country united, and that there are some who believe that their reality is the only reality. We have said no, we're going to have a safe zone. Safe zone means vaccinated or tested. Pick a choice. Okay? And that's why we want to discuss more with the churches. We want to discuss more with the entertainment community. We want to discuss more with the workplaces. With respect to the healthcare institutions, those discussions have already started. Before I came on air this evening, I would have advised BAMP, I would have advised the Barbados Nurses Association, BW and UPW that this is what I was going to announce. Recognizing that in many instances, people would want us to be able to say, right, that or nothing. But this is not a that or nothing country. There are some countries in the world that have mandated that you can only travel on public transport if you're vaccinated. Now tell me what will happen to people in Barbados if we did that. Tell me. You understand? So 166 square miles is a different reality to large territory. Yes, Barry?
And a follow-up question, when the safe zones are estimated outside of those priority areas you mentioned, and you start looking at areas of entertainment, restaurant businesses, etc., are you satisfied that our electronic vaccination certification program would be up to date so that people would be in a position to show such verification though? Because a number of people being vaccinated and have had to wait very, very long periods before they receive that electronic certification.
I'm going to ask Jeffrey to answer that because I know that the Ministry of Health entered into a relationship with persons to have it digitized. Jeffrey?
Yes, the process is ongoing, Barry. The team is now at about 60 persons who are actually dealing with this right now. Initially, certificates were being distributed, but we came up with a better certificate in terms of from a security perspective one that could not be easily reproduced, and one that would facilitate travel abroad where you can, using the barcode and the safety feature which we've now added to the certificate, that would make it safer for persons to be able to use and to travel. And they're being distributed. They're being
Thank
sent
you,
out.
Minister. While I have you there, I do have one question for you, Minister. At the top of your contribution, you spoke about your concern still about the level of young people who are being infected with COVID. But can you tell us if your public health officials are closer to find out what are the main contributing factors to so many young people becoming infected? Is it cross-infection from their peers? Is it infection mostly from their siblings or their relatives? Any information coming from public health people regarding that?
Well, this is one that I don't even have to wait on the public health people. I can tell you it's coming from the same way that everyone else is catching COVID, which is obviously people not following the protocols. And there's a requirement for persons who are, as I said earlier, parents, wards, guardians, whatever, to make sure that we do everything possible to be able to protect our children. And to show you exactly what I'm trying to say to you, when the children were at school doing face-to-face classes, you didn't have the problem that we are experiencing now, but the children are at home and in their communities and so on, and this is an issue. Obviously, we didn't have Delta several months ago either, so Delta is a game changer, but I believe, I'm satisfied that once we all do what we're supposed to do and follow the protocols, that everyone will be safe to a large extent.
Colonel Bostic.
Prime Minister, the testing, will the government be paying for the testing in the safe zones?
Paying for the testing in public facilities. Whether a restaurant chooses to be able to say to somebody that, look, you can do a rapid, and most of the tests are likely, I should say, to be rapid antigen tests, which is the ones that give back a response in 5-10 minutes. If a restaurant wants to have an additional service of being able to say that we're going to test you before coming in, they're free to do that, and you're free to deal with them just as you're free to choose off of the menu. But if you want to come to a public facility, the testing will be free there. And we've maintained that and will continue to maintain that, other than if you are traveling overseas. And we've made that very clear.
We have time for
Minister
just one more question.
CBC. Just a question, is there any contemplation of penalties being associated with the safe zones?
I would imagine that there will be penalties if you are breaching a safe zone. Wouldn't you?
Ryan, did you have a follow-up?
Would those penalties include things that we already have in place, or would there be new penalties?
No, I'm not going to speculate. That's for the Ministry of Health and the Attorney General to settle.
Are there any talks with Havana about the Abdala vaccine?
There have been talks generally with Cuba on all of the vaccines, but I don't think that they've had the approvals yet that they would like to have. And that is part of the difficulty. I told you that I didn't have the numbers earlier, and they've sent them to me. And the first doses that have been given since the 1st of September to today have been 30,482 people. So I didn't get my 30,000 in 3 weeks. It took a little longer, but we got it. And that's why I'm saying that I have every confidence in the people of Barbados that we will continue to build the numbers with the vaccinations, and in the establishment of these safe zones. Hopefully that will also be an incentive to persons to continue, and recognizing that if you don't, then well, you just have to be subject to the regular testing. And as I said, we will take care of the public spaces, but we're not precluding a restaurant or entertainment venue or a sporting venue, when it eventually comes to that, weeks or months from now, whenever, from being able to say that, look, we're going to offer you a test at X amount for the convenience sake. People do that all the time in this world.
I think someone had one.
Would you say the curfew has been in helping to control the spread of the virus?
we believe that it is necessary to keep numbers down and movement down sometimes. There are those who would want us to put even more lockdown. And as I said, look, in a perfect world, that makes absolute sense. But the world is not a perfect world. And the reality is that when you lock down, you're literally causing people to lose jobs, lose money, in fact, lose businesses in some instances. And therefore, what I'm asking for, look, Barbados got an old time saying called one below is kilo cow, Emmanuel. I'm asking each of you all, and sometimes I feel that perhaps the media needs to meet us also in this space to help us get back, because I'm sure that your advertising revenue is down, just as I'm sure that other people's contractual obligations have seen a diminution in income and revenue. I want as many people in this country to help us reach this goal. And if we can get there, believe you me, then it is going to be like a ton of bricks off of the majority of people's chests in this country, because people do want to get back. Even if you got to wear your mask, you want to feel as though you can still do some things that you used to do. And therefore, all I'm asking is that, look, let us work together, pull weight together. Many hands make light work, many jobs make life possible again. That's what it is.
And at this time, Prime Minister, let me thank you, Prime Minister the Honourable Mia Amor-Motley, and the Minister of Health and Wellness, Lieutenant Colonel the Honourable Jeffrey Bostic, members of the media, and you at home for joining. Good evening.